Our CVT, and this is our first fellow here, Dr. Nichols, along with KT, administers morning, and so she'll get in first thing in the morning before I even get there, and a lot of times even before the animal caregiver gets there. And it's nice because they're not conflicting as far as space. And she'll go ahead and do the morning treatments, and then also we have a technician that'll come in to do the evening treatments. And during that time, she identifies any major medical issues or changes in condition. So we might have a kitten that's not really down for a recheck, but she looked at it, it looks more quiet, or it's not looking like it's eating or something like that. So then we'll pull the record and make sure that we check that pet out. Medical observation sheet. On each cage and you'll see there's a medical observation sheet. So the animal caregiver, when they're feeding, cleaning, they'll make notations as far as if there's vomit, diarrhea, anything like that. So the CVT is going to see that and again pull the record so that I can go ahead and look at it. Assist with patients' initial protocols. So a lot of times you'll see, again, like if you look at this line here, the technician, when she's over at ACC, we believe so highly in the importance of the vaccination that it's done before it even comes into our facility. So when she's doing the heartworm test or the feline leukemia test, she's also vaccinating them. We don't want them in our facility for several days because the vet didn't get a chance to look at them, and meanwhile now they caught something. And I mean, so days or hours are critical to us that we want them vaccinated, ASAP. Now that might be done on, say it's done on a Monday. And then they might not come to us as far as by the time that all the animals are done at ACC, by the time they come in, it might be 3 o'clock, 4 o'clock, sometimes even later. If I've got other things to do or I can't get to them before I leave that night, then what I'll do is first thing in the morning, I just come in, do the exam, rabies, they're ready fasted, and then they go, if they're fast tracked, then they go right down to surgery. Fills prescriptions, completes medical plan, things like that. And this is this is Valentine, this is a very special mom that we had that was nursing, say 5 pups, and then we had another nursing mom who wasn't accepting her pups as well, and so this mom stepped in and helped us out, and nobody does a better job than mom when it comes to nursing kittens and puppies. And an initial medical assessment, ACC, we talked about. Daily rounds, this is the medical sheet. Well, a sample of it anyway. Usually we'll have a sheet for each section, so Abbott would have a sheet, ACC is going to have a sheet, and it's going to tell you where they're at as far as the location, dog or cat, what medicine they might be on, how often, and when they started, when they're finishing, so if we know if we want to extend it or not, and then the CVT goes ahead and initials off on it. Daily rounds. The animal is also assessed by the animal caregiver. Like I said, there's that sheet right here where it describes appetite and stool and urinary vomiting, things like that. So the animal caregiver is also responsible for doing the basics, but also looking at how they're doing clinically. And our animal caregivers, we try to assign them to areas that, depending on their skill level. So if we have ringworm, if we have a high-risk, more contagious disease such as dog parvo or feline parvo, such as panleuk, we want them to not be a fomite, so they're skilled. They're not going to use the same gloves for each cage, or they might gown up and things like that. So again, you might have animal caregivers that just like to feed and pet the cats, and that might not be a really good idea if you're dealing with an outbreak of diarrhea. And the veterinarian also does daily rounds as far as looking at the general population. But also I think what's really important is at least once a week what we try to do is go through the whole place and just see, especially if you have a moment where it's not as crazy, you're going to go around and see who's here, or why is this animal still here? Is there anything we can do to help this animal get out? We really believe in having a very fluid facility. We want things moving. We don't want the shelter setting is not the place for them as far as mentally and physically and all as far as that goes. Prioritizes patient care, workload, and resources upon arrival. So depending on what kind of help I have, I may say, okay, can you get weights and temps on these guys, and so we'll kind of divide and conquer. And it all depends on the workload too. You might have days where getting through the box is not a big deal, and then you have other days where there's 2 boxes and they're busting, as far as with records, as far as patients to be seen. So does what only a vet can do. And that's really ideally only what a vet can do, because usually the vet, we're taking out the garbage and all that stuff too. So basically we all pull together as far as just to get the job done. Provided with the animal inventory, foster, surgery schedule. So I'll have a few pieces of paper as far as lets me know an inventory where the animals are, as far as Abbott, ACC, down in the clinic. I'll have an inventory as far as who's here and where they're at. I'll have a surgery schedule as far as who needs to be cleared for surgery that morning. And usually we try to have them done by noon, so the surgeon knows we're not bringing animals down at 3, 4 o'clock, and they've already started on cats and they do dogs first. Support team needs to make the vet as efficient as possible, just like any great tech, they're going to stay a couple steps ahead of you. And the vet needs to educate, train, and delegate, and hold the shelter medicine team accountable for providing high-quality care. We try to treat them like they're our own pets. Integrates the Purdue University Shelter Medicine Fellow and externs. We do get externs, whether they be Purdue CVTs or senior students from Purdue. So incorporating them and having them be a learning experience for them. So this is just kind of an average, just a summary a little bit about what we do. CVT is going to provide medical treatment and rounds. The vet's going to review the population, determines priorities. We're going to clear them for surgery, hopefully by noon. And we also have fosters coming in at that same time. So slow track, we also do the rechecks of ones that we might be worried about or ones that we might hope to clear. And the CVT meets with the intake team at ACC. So roughly about 10 o'clock, they're going to meet the intake team as far as to do some of the health assessment over at ACC. And they might be gone from, say, 10 in the morning until 2 in the afternoon or so. In the afternoon, this is Hank, who was likely had some type of burn, whether it be chemical or heat burn or thermal burn at ACC, and we pulled him, and he's healed beautifully. As far as afternoon, we try to see the new intake seen by the vet, so we don't have to have the pressure of doing it the morning before noon when we have all these fosters coming in. Diagnostic testing, so we might be running some blood work, things like that. Dips that are usually done in the afternoon if we have ringworm or suspicious ones. Intensive care, that's done in the morning, and we'll check them throughout the day if they're on IV fluids, and foster rechecks, CVT, medical treatment and rounds. File review, it might be a pet that's going up for adoption and it has a fairly long history and they don't want it summarized, so for the adopter, and we'll go ahead and do that. And then we try to wrap up the day.